Hello everyone, this is Subhonmesh Bose from the Department of Electrical and Computer Engineering at the University of Illinois at Urbana-Champaign. I'm here to introduce our work on resource management to combat epidemics. This is joint work with a collection of colleagues at the business school, namely Anton, Sebastian, Sridhar, Ujjal and Yuqian. This work is supported by a grant from the C3 AI Digital Transformation Institute. Our project largely aims to manage the allocation of testing, protective, and curative equipment. Driven by the needs of the current COVID-19 outbreak, we have been focusing on mainly the allocation of testing equipment, but in the near future, we also want to work on issues that arise due to inflexibility that exists in medical supply chains so that we are better able to plan for future epidemics. So now let me walk you through some of the preliminary work we have done on allocation of testing. The question of allocation is one of matching demand with supply. Now, a crucial component of that is to predict demand. How many test cases is there going to be at a particular place at a particular time? That we are able to essentially predict fairly accurately in the short term, 7 to 14 days, with a compartmental epidemiological model. A quick key takeaway is that accounting for mobility, that we have data from Cubic within and across counties, improves the accuracy quite a bit in such predictions. We've also done a hotspot prediction. Hotspots are locations that bear the burden of and/or are responsible for infection spreads. So we've used a deep belief network framework to do hotspot prediction using data. And again, the key takeaway is mobility is a key factor in determining such hotspots. So given that if you are able to do such demand prediction, what can you do with it? Well, we can utilize these demand predictions and a collection of potential test sites, and we've actually developed a framework to allocate test kits. We, of course, have to account for practical constraints, right? Such as the maximum driving distance for patients to a testing facility, or the maximum number of kits that a particular testing facility can handle, and so on. So we've already developed a framework to do this. Now, building on this, what we are currently working on is to look at an epidemiological model that explicitly accounts for asymptomatic cases, the impact of testing on even the epidemic dynamics, through quarantining and so on, and also the effect of mobility that I've been saying from the start. With this kind of an epidemiological model, our goal is to design a comprehensive dynamic allocation mechanism, one that also mitigates the spread and allows policymakers to design a dynamic relaxation of lockdown policies. Thank you.